So the secretary of that NHS, Lord Nigel Crisp, after the retirement, so he could realize how nurses and midwives are were required for the effective healthcare delivery system in that country. He was able to capture the evidence of nurse-led clinics and how some of the nurse practitioners working in the different parts of the globe made an impact and outcome for the patient outcomes, how they were able to save the cost of the expenditure of the hospital, how they could reduce the admissions to the hospitals, how they can be, with the limited bed capacity, how they can admit more patients and the resources can be saved. All that evidence-based which we captured and took it to the WHO and to the ICN and the World Health Assembly in 2020. You know, the World Health Assembly, 190 countries representing the World Health Organization. Each country in the month of May, generally World Health Assembly held in Geneva, where all the health secretaries, all the health ministers, all the director generals, generally from each country, 15 to 20 delegates will go to the Geneva and participate in that World Health Assembly. Such a very important World Health Assembly, which generally discusses the global health trends and comes out with the resolution to the countries for the implementation. In that 2020 World Health Assembly, this was the first time the WHO brought out State of the World Nursing Report. It's called SOWN report, SOWN. You can access that report in our Indian Nursing Council website. I think I expect all the faculty and the students should read that SOWN report, which is having a very important information about the nursing and midwifery at the global level, which is there, which is very good for the for our day-to-day life working as a nurse. So in that, the SOWN report that WHO came out with, they expected 6.6 million shortfall of the nurses globally. And many of the countries after the pandemic, a lot of people are leaving the nursing profession because of the risk factor, and also the working conditions are not effectively provided in some of the countries. So a lot of the nurses are leaving. So ultimately the International Council for Nurses has estimated about 16 million shortfall at the global level. In India, I think it is expected another 2 million nurses need to be trained. So the government of India recently, the last budget, I think to address the issue where the 157 medical colleges established and to have a co-location of the medical colleges which have been established, 157 nursing colleges have been sanctioned by the government of India to address as one of the issue, this shortage of the nurses. And when in the SOWN report, very important 4 themes have been, Lord Nigel Crisp has made it. One is the first, the theme is in that whole report, you will see the investment. The report is requesting all the countries, including the WHO, to make a resolution. The countries has to invest money for nursing. The second theme is creation of the nursing positions. That is very, very important, at least to India. I think many of even the government nursing school at the state level, the teaching posts are not properly sanctioned as per the Indian Nursing Council now. So, and also the nurse-patient ratio, which is the staff inspection unit of the Ministry of Health and Family Welfare, which has been approved. Only the aims and some of the premier institutions are being followed, but not in the state governments. Many of the state governments, hospitals, still they are not implementing the nurse-patient ratio of the government of India laid down. So therefore, creation of the nursing position is a very, very critical. Number 3, leadership. So they have made an evidence that if the ward sisters, if the assistant nursing superintendent, deputy nursing superintendent, and leaders, if they are given a leadership skills, because since the nursing is one profession which they have to work with it as a team member, though the impact and outcome can be successful. That is the evidence which has been shown. So therefore, this the third theme was the leadership. The fourth is the service delivery, which is very important, asking all the countries to have a proper working conditions, the proper salary, proper equipment and supplies for the nurses to provide the nursing care. All these issues have been dealt in the service delivery. So these four themes are very effective, very prominently made by the World Health Organization, and they have also come out with a strategic direction for nursing and midwifery, SDGNM 2025, because generally WHO works for the 4-year cycle period. So the next 2025, the World Health Assembly is going to take up the agenda again, nursing, and then that second zone report is going to be released. Now the WHO again thought of from 2020 asking all the countries in the forum of National Health Workforce Accounts. Because the first time when I heard the word accounts, I was also surprised. What is happening in accounts word for the human resource? So now the WHO is asking all the countries to give the data of all the health human resource every year. So that is in the form of National Health Workforce Accounts, and they will maintain a data at the global level and advising the countries for the effective human resource planning for the health. So the second zone report is going to be released in the 2025 on the April 7th, being a World Health Day on that day, and again it will be discussed in the May World Health Assembly meeting, and they will come out with they will start taking what has happened from the first zone report to the second zone report. And again, similarly, the International Confederation of Midwives, ICM, also has come out with the midwifery report, and these all recommendations. I think Ministry of Health under the NHM, they have agreed for the nurse practitioner midwifery program. The Indian Nursing Council started first on a pilot basis. Now it has become a pan-India program of the nurse practitioner midwives. NHM has an official commitment that they are going to train 86,000 nurse practitioner midwives. The training cost is going to be met by the NHM, Government of India, and midwifery-led units are going to be positioned so that to reduce the maternal mortality and the neonatal mortality. One of the solutions have been identified. The training has been started. I think you were close to the Nagpur in Wardha. I think the nurse practitioner midwifery program has started. Sometime we should go and observe how those midwifery clinics are functioning in the OBG wards. So the nurse practitioner now, the specialization is a new era. Therefore, Indian Nursing Council started the nurse practitioner critical care program. It is a 2-year residency format. Because many a times we nursing professionals are questioned that you people spend a lot of time in education in the classrooms, not in the clinicals. So therefore the Indian Nursing Council has corrected the course of action, just like MD, MS, the medical professionals, they are there in the clinical all the time. Similarly, the nurse practitioner critical care is a 2-year residency format. They are there in the ICUs. They are not in the only about 5 to 10% of the time they are spending in the format of seminars in the classroom, but they are the maximum time they are in the clinicals, and which has started in the many parts of India. About 57 institutions have been started this nurse practitioner. Now the government of India realizing, which is going a lot of results, and especially during COVID, many of the ICUs have run by these nurse practitioners in critical care and made an impact and outcome. So therefore now the government of India has told us to prepare 10 nurse practitioners in geriatric and also in the neonatology, pediatric, psychiatric nursing. So the 10 nurse practitioners with the syllabus which we have prepared, and at least to come to the Maharashtra, we are very happy to inform you that Mahatma Gandhi Medical College in Mumbai, Krishna Institute of Karad, these are the 2 institutions successfully, and especially during COVID, the intensivist, at least from these 2 institutions, they rang up and told me that your nurse practitioner critical care came to handy during COVID period to run the ICUs. So in these 2 institutions, we could see the positive impact and also the eagerness of the administration to have the nurse practitioners, and especially intensivists they wanted. Actually, this whole program was initiated, I requested Devi Shetty, I I think you might have heard, is one of the pioneer in the healthcare delivery system, and many of the policy prescriptions are given by him to the ministry many a times. Person who was the then now the health minister, the Nadaji, he went and requested about half an hour time. He spent about 5 to 8 minutes on nursing. So in that, one of the things which he requested the ministry is to start the nurse practitioner critical care. That's how we were able to get the support from the Ministry of Health. And even before approving the nurse practitioner critical care program, this meeting was held at the level of the secretary and various state health secretaries, and the DG participated in that meeting. The first approval we got for the nurse practitioner critical care from the government of India. That's how it has been started. And by seeing the impact and outcome, and in developed countries like USA and Australia and all, the highest qualification a nurse can think of is in the clinical side, because in the education we have a PhD in nursing and all, but in the clinical side, the highest doctor of nursing practice, that's called DNP. So we signed an MOU with the University of Houston, Texas, and the Texas people with the collaboration on a pilot basis. We have started the DNP program. Only last month we inaugurated in the Mahatma Gandhi Medical College in Mumbai and Krishna Institute of Karad. I think we want to see how many of the overseas, many of the units, many of the CEOs happen to be the nurses with the DNP qualification. So you are all fortunate. You are getting into the nursing where the future is so bright. If you are bright, I think you have a lot of opportunities to work in India, and also to you have opportunities to work abroad also. So therefore, your interest, how you are going to take this profession, and at least know, even while I was working, at least when I reflect my working as staff nurse initially, and especially between the 2 to 4 when the ward is very light, at that time we used to spend a lot of time with the patients and doing a lot of dressing, and a lot of many of the patients used to ask, "Aaj dressing kar dijiye, mere ko neend nahi aa raha hai." So the day which I have done the dressing, next day they used to tell me, "Brother, mere ko acha neend aa gaya." I think whatever the blessings, the patients which you are going to give to you, that is cannot be equated with the financial resources. So therefore, you have a golden opportunity to work with the patients, because the patient safety is a very important. You are a patient advocate. You are one of the role you are performing. So therefore, your patient safety, for that, all necessary precautionary measures which you have to take, and especially also reducing the infection rate in the clinical, that is also a big challenge for the nurses. So therefore I am very happy that to participate in this very important function, and hopefully when you pass out, and I think you have to bring laurels to this your institution, your faculty, and to the institution. I think somebody when you are working, once you say that you are AIMS College of Nagpur, we should be able to remember the quality of the nursing education which is given by this institution. That type of a standard which you have to cultivate. Not only you have to bring name to the institution, and also you have to bring the name to the faculty, and also you have to bring to the country. So wish you best of luck. Thank you very much.
Speech, sir, and I assure you that our students will be our nation's pride in near future. Are you? Yes. Thank you.
Now I invite our Honorable Executive Director to felicitate our Chief Guest with the memento.
Welcome you all.
Thank you, sir, and thank you, everyone.
Good morning, everyone, and chief guest of the event, Dr. T. Dilip Kumar, President of Indian Nursing Council, other dignitaries on the dais, Principal Nursing College, Rajini Peter, Deans of all of our college, Dean Academics, Dr. Murunal Patak, and Dean Examination, Dr. Dakhile, Dean Research, Dr. Pradeep Deshmukh, Deputy Director, the Medical Superintendent, and all the students over here who have just got admission here of Nursing College. The nursing faculty also is here, and also the nursing officers, administrative staff, and all dear students. It's a proud privilege to stand in front of you to address the first batch, the fourth batch of the BSc Honours for this oath ceremony and lamp lighting ceremony. A very elegantly performed function, I must say, and very disciplined students sitting in front. And you should all be proud that you have got admission to the premier institute of national importance like AIIMS Nagpur in the BSc Nursing course. And I congratulate you for being admitted and for pursuing this course here. I also would like to congratulate you all students here for choosing nursing profession. This is a very important profession. See, doctors come and see the patient, talk with the patients who are hospitalized for about 5 or 10 minutes, examine the patient, and then go away after the rounds. They advise what treatment needs to be done or what investigations have to be done. But it is the nursing staff and people which the profession which you have chosen, who actually stay with the patients nearly 24/7 and interact with the patients and give them empathy, compassion, love, and it is these qualities which actually cures or helps the patient to recover. Medicines are there which will take care of the illness, but for a speedy recovery, it is very important that a good nursing care and nursing professions, how they talk with the patients, how they develop a rapport with the patients, and how they compassionate and loving they are, and build confidence in the patient. It goes a long way in improving the health and curing the patient. And therefore, nursing profession is a very important profession. And the competent nursing officer or nurses should not only be knowledgeable, skilled, but also should have qualities of being compassionate and also have empathy and sympathy for the patient. And this needs to be inculcated, practiced. Very important for you that you will now be posted in clinical wards and you will now interact with the patients. Medicine, as they say, is a science, but the practice of medicine is an art. And therefore, it is very important that you develop this art of interacting with the patients, communicating with the patients, building confidence with the patients, giving them the right medications at the right time. And that will go a long way to improve the health of the patients who are under your care. We have a wonderful campus over here. the academics part, the very well worked up planned curriculum and syllabus which will make you very competent nurses when you pass out. We have a very well equipped library which is called the Learning Resource Center, a very good skilled lab where you can practice some of the skills which are needed for doing basic nursing routine things which is expected from nursing officers to be done. And therefore, you should utilize these facilities to the fullest extent. A very competent faculty is here to teach you and guide you. In addition to that, we are always there to help you. And if you have any other issues and problems, you are always most welcome to approach us anytime. And even in odd hours, not only for your professional problems, but even for your personal problems, you are most welcome to approach any of us over here, your nursing faculty, your principal, or the medical faculty, and even me. You can approach me directly if you have any professional or personal problems and which you think that I can solve. We will definitely help you all in that manner. It's also very important that you lead a very disciplined life. You be devoted. Devotion to this profession, being devoted and being passionate about your profession will make you outstanding nurses. And therefore, it's very important that you be very regular in your classes and lead a disciplined life, sleeping in time, getting up early, having a healthy food, avoiding all that junk of Pepsi and Pepsi colonization and McDonaldization, which has crept into this new generation, should generally be avoided, and which will help you to assimilate all the things which are necessary to become a good nurse. And I would like to congratulate the College of Nursing, the principal specifically, for organizing such a wonderful and elegant program. Lamp lighting, the oath taking ceremony, very elegantly performed. I am impressed. I must confess that this is the first full-fledged program which I have attended. And I am really overwhelmed by the solemnity and the elegance with which this program was conducted, and the disciplined way in which all these students were sitting and performing. Thank you and congratulate you all. As I conclude, I would like to remind the nursing officers and your new students over here that the motto of our institute is passion for excellence, and therefore your actions should reflect excellence. Wishing you a very good, happy learning at AIIMS Nagpur. And we should not only be in the field of academics, but also in non-academic activities like playing games, as well as we have a wonderful cricket ground, we have wonderful badminton hall and other things which are necessary for you to become a whole person as a whole. And use all those facilities, very disciplined, and wish you all the best. Thank you very much.
Thank you for your guiding words, sir. Now it's time to acknowledge the academic toppers for their achievements. We would like to